Hi everyone, welcome to my YouTube channel Indian Doctor. In this series, we are discussing UPSC Medical Science Optional previous year questions. Here is a question from General Medicine of the year 2021. The question and answer discussion will be in such a format that it will be helpful for you to reproduce the same in the exam. The question is, discuss in short the etiology, diagnosis, treatment and complication of cirrhosis of liver. Each carries 5 marks and it is a 20 marker question. So the question asks about cirrhosis of liver. So we can start with the definition of cirrhosis. It represents irreversible end-stage disease causing hepatocellular injury and is characterized by involvement of entire liver. Lobular architecture of liver parenchyma is disorganized. Nodules separated from one another by a fibrous band. Alternate areas of necrosis and regenerative nodules. Coming to the etiology, the most common cause is alcohol intake, alcoholic cirrhosis, and then the next most common cause is viral hepatitis, chronic viral hepatitis caused by hepatitis B or C virus. Next, non-alcoholic fatty liver disease, also called as non-alcoholic steatohepatitis. Under the immune-mediated disorders, there is autoimmune hepatitis, biliary cirrhosis, both primary and secondary. Among drug-induced hepatitis, methotrexate is most common drug, isoniazid, sulfonamides. In genetic disorders which causes cirrhosis, hemochromatosis, Wilson's disease, alpha-1 antitrypsin disease, glycogen storage disorders. Next is chronic venous outflow obstruction, and last is idiopathic cirrhosis. This will be the etiology of cirrhosis of liver. Moving on to the diagnosis. Under diagnosis, I have mentioned diagnosing through clinical signs and through investigations. So a diagram format, when you represent, you're definitely bound to get higher marks. So a graphical representation from head to toe, what are the signs of cirrhosis of liver? From the head to toe, icterus, malar erythema, parotid swelling, spider nevi, gynecomastia, splenomegaly, ascites, caput medusae, reduced pubic hair, flapping tremors, dupuytren contracture, palmar erythema, testicular atrophy, pedal edema. Moving on to the investigations. Do a complete blood count. We will find anemia, leukopenia and thrombocytopenia. In LFT, there will be hyperbilirubinemia. Both conjugated and unconjugated bilirubin will be high. The transaminases will be elevated, that is SGOT, SGPT, also called as AST or ALT. Alkaline phosphatase will also be mildly elevated. There is rise in gamma glutamyl transferase. There will be hypoproteinemia and there will be albumin to globulin reversal. In coagulation profile, we can see that PT, prothrombin time, and activated partial thromboplastin time, both will be prolonged. Blood ammonia will be the characteristic investigation that we will be doing in case of cirrhosis. Viral markers to find the etiology of cirrhosis. In ultrasound, we can see the liver size is small, coarse ecotexture of the liver, ascites can be found. Also, portosystemic collaterals can be identified in ultrasound. Fibroscan. It will show the amount of fibrosis. Liver biopsy is the gold standard investigation to find out cirrhosis because cirrhosis is a histological diagnosis. Moving on to the complications. Here, if we just list out the complications should be enough. So the most common complication is portal hypertension. The definition of portal hypertension is hepatic venous pressure gradient, HVPG. If it is more than 5 millimeters of mercury, then we state it as portal hypertension. Other complications are ascites, spontaneous bacterial peritonitis, hepatic encephalopathy, hepatorenal syndrome, portal vein thrombosis, hepatocellular carcinoma, variceal bleeding, hepatopulmonary syndrome. Moving on to the treatment of cirrhosis of liver. So the baseline, we have to treat the causative agent. We have already seen in etiology what are the causes of cirrhosis of liver. So the treatment of cirrhosis will be dependent on the what is the etiology. If it is because of alcoholic, then we have to stop alcohol intake. Viral hepatitis, then we have to give adequate and proper antiviral agents. In immune mediated disorder, we have to give immunosuppressive drugs. If any drug is causing cirrhosis, definitely we have to stop the drug. The first treatment is the causative agent has to be removed. Next, the nutrition of the patient, high protein diet, minimum of 1 gram per kg per day and 2000 to 3000 kilocalories per day. Next, in the management of the cirrhotic patient, we have to treat the complications. We have already read what complication occur, like variceal bleed, ascites has to be treated accordingly. Once a patient is diagnosed with cirrhosis, endoscopy has to be done for screening esophageal varices and it has to be repeated every 2 years. Patient with cirrhotic liver has increased risk of hepatocellular carcinoma. Hence, regular surveillance for development of carcinogenic cells has to be done. If the patient lands in liver failure, then liver transplant is the management. So this is the answer for this question. Hope it was useful. Thank you.